The following is a presentation of 5 things every parent should know about teen substance abuse. For more information, please visit our website at www.5thingsonline.com. Five things every parent should know about teen substance abuse. Part 5 in a 5-part series. Number 5. Treatment works. Drug or alcohol addiction can be devastating and is perhaps one of the most difficult challenges an individual may ever have to overcome. And despite all the horror stories, the simple fact remains: addiction can be successfully treated and recovery is possible. Unfortunately, when we tend to hear more about treatment failure than success, the public perception of rehab becomes tainted. As discussed earlier, denial plays a big part in this problem, and therefore is at least indirectly related to virtually all aspects of treatment failure. This can range from not getting proper treatment because of misdiagnosis, as discussed in Part 1, to simply receiving poor treatment, as the quality of service can vary drastically from program to program. In any of these cases, the uninformed client is vulnerable to being misled or not knowing that the service they are receiving is in fact misdirected or inadequate. But perhaps the biggest reason for low success rates is failure to follow treatment recommendations and premature withdrawal from the process. While addiction can indeed be successfully treated, nobody said it was fun or easy. Education is the key to combating denial, and greater public awareness of how the treatment process works would ultimately lead to improved treatment results. That being said, here's a little primer on what substance abuse treatment is all about. The most widely accepted model for treatment today has its origin in what is referred to as the Minnesota model, which represented a shift that occurred in the 1950s with regard to treatment of alcoholism. Moving away from the typical drying out period in the jitter joint, a new, multidimensional therapeutic approach was introduced. This was most noted for being an abstinence-based model that integrated the 12-step program of Alcoholics Anonymous and included education about the disease concept of chemical dependency. Also new with this approach was programming to involve the entire family in the treatment process. And finally, out of the recognition that treatment was more effective if the length of stay was extended, the 28-day model with which we are currently familiar was born. Treatment today, therefore, includes all those things that have become recognizable to us through TV shows and movies: doctors, nurses, counselors, group therapy, lectures, 12-step meetings, and yes, maybe even making a belt or some moccasins. One area that can be confusing when considering treatment is the seemingly vast number of options that make up the various levels of care. It's not really that complicated once you understand that there's a continuum of care that involves a series of graduated step-downs in level of care. Then it's simply a matter of determining where a client needs to begin. Here's a quick rundown. Inpatient hospitalization. This is typically a short stay in an acute care psychiatric hospital for detox or stabilization following an overdose or drug-related crisis, such as a suicide attempt. While there may be some programming that addresses substance abuse, this is not chemical dependency treatment. A substance abuse patient would be referred on to appropriate treatment following stabilization. Residential Treatment Center, or RTC. The client lives at the treatment facility for an extended period, typically from 1 to 3 months. This would be considered primary treatment. Intensive Outpatient, IOP. The client lives at home and attends programming at a local facility. A typical IOP schedule would be 3 to 5 group sessions per week, plus individual counseling, for anywhere from 4 to 10 weeks. Some clients may begin their primary treatment in IOP. Clients who begin in RTC typically step down to IOP as part of their ongoing care. Outpatient, This term refers to individual counseling or group therapy, typically 1 to 3 hours per week. This would be the final step down in level of care following completion of IOP treatment. Aftercare. Upon completion of a primary phase of treatment, clients enter into the aftercare phase. A typical aftercare program includes weekly group and/or individual sessions for up to 1 year. The significance of aftercare illustrates an important point regarding successful recovery. It's a long-term process. As mentioned earlier, the biggest reason for treatment failure is premature withdrawal. That means quitting before you're done. An unfortunate trend in treatment today has been the disappearance of quality aftercare programming. With the coming of managed care in the 1990s, reimbursement for aftercare disappeared. Where programs used to have entire dedicated aftercare departments, today we see watered-down versions of aftercare where clients are simply allowed to attend the primary group once a week for a year. Okay, so who goes where? Clients with a substance dependence diagnosis require intensive treatment. This means entering the process at either the RTC or IOP level of care. Determination is based on severity of the addiction, degree of cooperation, the home and social environment, and whether there are any co-occurring disorders. Outpatient counseling is not enough to provide proper care for the client with a substance dependence diagnosis. Clients with a substance abuse diagnosis may in some cases require intensive treatment in RTC or IOP. Other options include alcohol or drug awareness classes and outpatient counseling. The treatment process involves helping the client understand and accept the nature of his or her problem and how to achieve a drug-free lifestyle. Education is provided to help clients learn about things such as the medical aspects of addiction, relapse prevention skills, feelings and defense mechanisms, and much more. Therapy is required to address the emotional impact of addiction, which includes feelings related to consequences of their use, as well as examining unresolved emotional issues that may have contributed to the reasons for chemical use in the first place. As denial is a significant aspect of the disease, treatment inevitably requires honest self-examination, which doesn't always come naturally. A primary reason for group therapy is to afford clients the opportunity to receive feedback from peers, as well as to learn by watching others go through the same treatment process. The family is typically asked to participate in group sessions as well as education groups. A significant aspect of treatment is to allow family members to examine how the addiction has impacted the entire family system and process their feelings about this. This is one of the areas where valuable work is frequently accomplished with immensely positive results. In summary, substance abuse causes a person to change. They're not themselves anymore. One of the most frequent statements I hear from parents shortly after treatment has begun is, "We feel like we have our child back." And this is only a week or two into the process. At this point, they don't realize that there's still a lot of hard work ahead. But if they stick with it, the good they're seeing now is just a fraction of what they'll experience in time. Restored family relationships, open and honest communication, healing of long-standing resentments and other unresolved emotional issues, the regaining of trust, these are just some of the benefits of treatment. Parents see a new look of confidence and self-esteem in their child, along with a remarkable display of values, respect, responsibility, caring for others. These are all characteristics of a recovering person. It may sound too good to be true, but trust me, this is what happens with successful recovery. There's a phrase around recovery circles that says it all: expect a miracle. These three words simultaneously acknowledge the seemingly hopeless place that addiction takes the sufferer and the hope that comes with recovery. Miracles are occurring every day in treatment programs all around the world.